The world is currently facing is a major pandemic, and this is not a pandemic that is going to go away at the end of 2020. Right now in South Africa, we're still sort of at the start of the first wave of the pandemic, and in all likelihood, we will continue experiencing waves of this pandemic until at least about 60 to 70% of the population become infected. Which means that a large number of people, unfortunately, will die if we actually wait for 60 to 70% of the population to become infected. Now, one of the ways in which to mitigate that from happening is by basically trying to induce community immunity against the virus using another strategy. And the most effective strategy that is available to us globally for all other infectious diseases, which is what we're trying to apply to COVID-19 now, is basically to develop a vaccine. So with the vaccine, you can accelerate what we call a community immunity against the virus. And once you accelerate that from occurring, what happens is that the ability of the virus to actually transmit between people becomes less efficient. So it is possible that natural infection with this virus will induce immunity. The question is, how long-lasting is that immunity going to be, which is an unknown at this point in time. But like I said, once roughly about 60 to 70% of the population are infected with this particular virus, then the force of infection that occurs in a community is reduced. Now, with the vaccine, our previous experience with many other vaccines has been that you can accelerate that sort of community immunity from evolving, and you can get it done over a very short period of time, depending on the number of doses of vaccine that's available.